Assalamualaikum warahmatullahi wabarakatuh. Hi everyone, I'm Wira Uswatun Hasanah from Alauddin State Islamic University Makassar, majoring in pharmacy. So today, let's talk about Pfizer and BioNTech COVID-19 vaccines. Currently, there's been over 72 million cases of COVID-19 and over 1.6 million deaths worldwide. Despite effort to stop the spreading with physical distancing and wearing masks, those numbers keep rising. And for many of us, the promise of a vaccine feels like hope. At the end of a devastating year, these vaccines are being fast-tracked, created at record speed, leaving scientists and the public with many questions. Ever since January 2020, when the novel coronavirus genome was first sequenced, the race to create an effective vaccine was on. And because of the pandemic, researchers worldwide were being poured into the development of COVID-19 vaccines. Currently, there are 52 vaccines that are being tested on volunteers and another 162 vaccines that are still in preclinical development. Vaccines work by showing your immune system a small piece of the virus, and most vaccines contain a protein and that gets injected into your body. But messenger RNA are different. Rather than giving the protein, the messenger RNA provides the instruction for your body to create the protein. The SARS-CoV-2 virus has a distinctive spike protein on the surface that allows the virus to enter the human cell where it replicates. This is the protein that the vaccine tells your body how to make. Messenger RNA is really delicate. It gets wrapped in a protective oily layer of lipid nanoparticles, and that's how it makes it to cell without getting destroyed. The vaccine is then introduced to your body with an injection. After it makes its way into the cells, the messenger RNA instructions are read and your cells create many copies of the spike protein. Just as your cells normally destroy its mRNA after reading it, it does the same thing to the vaccines, leaving no trace of it in your body. Messenger RNA never enters the nucleus of your cells, where your genetic material called DNA is located. So, although mRNA is genetic material, it doesn't change or interact with your genes. Once the spike proteins are created, they are expelled out of the cell where they then can come in contact with your immune system. But remember, this is just a tiny protein, just one part of the virus. So it can infect you or it can give you COVID-19. Your immune system then recognizes the spike protein as foreign, and it creates specific antibodies that are designed to attach to the protein and neutralize it. Finally, your new system creates a memory to the spike protein using memory B cells and memory T cells. Now, your body is ready to jump into action to protect you as soon as it comes in contact with SARS-CoV-2 virus. So, this is the type of vaccine that was created by Pfizer and BioNTech, which has recently been approved for mass distribution in 4 countries: the United Kingdom, Bahrain, Canada, and most recently, the United States. On November 18, Pfizer and BioNTech announced the result of their much-anticipated clinical trial. So, basically, what they did was recruit over 43,000 volunteers from 6 different countries. These people range from an age 16 to 91 with average age 52. 10% of participants were Black, 26% were Hispanic, 5% were Asian, and only 1% were indigenous people. These 40,000 people are then randomly assigned to one of 2 groups. One group get the real vaccine, while the other group get the fake vaccine called the placebo. And the whole goal of the trial is to see, is there a difference between these 2 groups? Does the vaccines really work, and are there side effects? So, of those 170 patients who got sick, only 8 of them had the real vaccine and the rest of 162 had the fake vaccine. This vaccine has 95% efficacy at preventing COVID-19 illness. In this trial, there were 10 patients who became really severely ill. 9 of them had the fake vaccine and only 1 had the real vaccine. So, basically, if you get the vaccine, you're less likely to get COVID-19. And if you do get COVID-19, you're less likely to become really sick and end up in the hospital. In this trial, there were no seriously safety concerns, so volunteers described having a painful arm afterwards. Some talked about fever, headache, muscle ache, but those all resolved within a day or two. And really, they weren't serious or life-threatening. Very rarely, like any medication, it's possible to have a severe allergic reaction, but this wasn't seen in the trial. So this data was collected over 2 months, but trial is going to keep going and collecting data over 2 years. This trial was looking at symptomatic patients, so people who felt sick and then were diagnosed with COVID-19. It didn't look at asymptomatic carriers. So people who have the virus who can even spread the virus to other people but don't have any symptoms. I suspect that we're going to need to keep wearing our masks even after we've been vaccinated, until we know if the vaccine prevents the symptomatic carriers of COVID-19 or until enough people in the community have been vaccinated. Okay, I think that's all for Pfizer-BioNTech COVID-19 vaccine. I hope this information can be useful for all of us. And don't forget to wear your mask and keep your distance. Stay safe and stay healthy. Goodbye. Wassalamualaikum warahmatullahi wabarakatuh.